Lunch and Learn, Black Maternal and Infant Health and Policy and Practice. I'm Priyam Choksi, the Director of Community and Legislative Strategies for CelebrateOne. Before we get started, there are a few housekeeping items I'd like to review. To improve audio quality, we ask that our partners remain muted for the duration of the event. However, we will be taking and encouraging questions. To ask a question, simply type it into the chat box and press enter. CelebrateOne staff will then forward your question to our moderator. Staff will also be monitoring the chat box for the duration of the event and will do their best to ensure that all questions are answered time permitting. Today's event is being recorded and will be made available on both the CelebrateOne and City of Columbus Facebook pages later this week. For those who may be joining us for the first time, I'll now share a brief overview of CelebrateOne. In June 2014, the Greater Columbus Infant Mortality Task Force ended its 6-month process with the release of its final report to the residents of Franklin County. In it were 8 recommendations to reduce the community's alarming infant mortality rate by 40% and cut that racial disparity gap in half by 2020, end of this year. CelebrateOne was created in November 2014 to carry out the task force recommendations and ensure that Franklin County meets its ambitious goal. We are a collective impact initiative made up of a vast coalition of multi-sector partners working to reduce preterm births, eliminate sleep-related infant deaths, and improve the socioeconomic conditions that drive disparities in our high-risk neighborhoods. So we have been able to affect change and build our coalition due to the leadership, political will, and the vision of our mayor, Andrew J. Ginther, who I would like to introduce now to kick us off today. So I see that he is on and has joined us. Mayor, the mic is yours.
Well, thank you, Priyam, and thanks to everybody for joining us here today. I'm excited to be with you to continue working together on these very critically important parts of this administration's equity agenda. We have some incredible partners that are joining us here today. I want to thank Director Stapleton, Representative Crawley, Senator Stephanie Coonsey, Jessica Roach, Dr. Pat Gabby, and all of you for joining us. We are involved in some of the most important work of this community with focusing on better birth outcomes for our youngest neighbors. This is very personal to me. I have a 10-year-old now, but back in 2013, it was my daughter's third birthday, and I was going to an Equity Institute event over at the Lincoln Theater on the Near East Side. I always point to Dr. Pat Gaby and Dr. Art James as kind of being co-conspirators and helping us all get into some good trouble with this work. And Dr. James was hosting this Ohio Equity Institute, really focusing on disparities. And I asked to go early on the agenda that night so that I could get home to celebrate Clara's third birthday with her. And it was at that event with those dynamic leaders from across the state, I thought and believed that this is what I wanted to focus on as council president. And that launched the Infant Mortality Task Force, and as Priyam said, led to the work and creation of CelebrateOne. We're blessed with many great partners that got us to this point. This is another incredible example of public-private partnerships. We're blessed with a governor who believes very strongly in this work and has been a great supporter of ours, as well as the state legislators that are part of this webinar here today, and we're grateful for them. I really view reducing infant mortality and providing better birth outcomes as kind of the cornerstone of my administration. Earlier this year, I laid out the equity agenda at West High School back in February to call out and address racism and discrimination wherever we find it. Infant mortality is one of the social determinants of health of a neighborhood, and it should surprise no one on this call that infant mortality is higher in neighborhoods that also suffer from higher unemployment, higher homicide rates, higher eviction rates. CelebrateOne is making tremendous progress in reducing the number of infant deaths in our community, which is terrific. Now we have to be absolutely laser focused and double down on our strategies to cut the racial disparity. I believe in the work of our CelebrateOne team and all of the amazing partners, and very excited to introduce to some of you for the first time our new executive director of CelebrateOne, Maureen Stapleton.
Thank you, Mayor Ginther, and thank you for your commitment to the young people of Central Ohio. I am Maureen Stapleton, as the mayor said, the newest member of the team, and I am absolutely elated to be here and to get to know every one of you as we continue to work toward what the mayor indicated was an important goal, which is not only to continue the right way that we're going with infant mortality, but to reduce the racial disparities that we know exist. So look forward to a call from me or reach out in some way as I begin to learn each of your organizations and the critical roles that you play. I'd like now to introduce our expert panel. And when I heard who was on the panel today, I was exceptionally excited. And again, look forward to meeting some of them for the first time here today and getting to know further others who I've met in the last few weeks on webinars and Zooms. Joining us today from the Ohio General Assembly is State Representative Erica Crowley and State Senator Stephanie Kunze. State Representative Erica Crowley is a mother, advocate, and veteran. She currently represents Ohio's 26th House District, which includes much of the eastern and southeastern part of Columbus. Originally from Youngstown, Ohio, Representative Crowley's family reflects the diversity, successes, and struggles of families in Ohio. She is a first-generation college graduate, obtaining a Bachelor's of Arts degree in criminology with a focus on juvenile delinquency from Cleveland State University. She also holds a master's degree in public administration from Walden University. State Senator Stephanie Kunze is currently serving her first term in the Ohio Senate, representing the people of the 16th Senate District on the western side of Franklin County, including the cities of Dublin, Galloway, Grove City, Hilliard, Upper Arlington, Worthington, and portions of Clintonville and Columbus. Senator Kunze is an active member of the Infant Mortality Commission, serving as co-chair, as well as the Ohio Family Stability Commission. She also has been appointed to the chair of the Ohio Children's Trust Fund, Governor's Executive Workforce Board, co-chair of the Undergraduate Mission Studies Committee, Home Visiting Consortium, the Commission on Minority Health, and the Women's Suffrage Centennial Commission. We are also joined by Jessica Roach. Jessica is the co-founder and chief executive officer of Restoring Our Own Through Transport, or otherwise known as ROOT, a nonprofit Black women-led reproductive justice organization focused on maternal child health and birthing justice in Columbus, Ohio. Her work has spanned over 20 years in areas such as clinical nursing, public health advocacy, and independent scholarship. Ms. Roach currently serves as the co-chair of the CARE Working Group for the Black Mamas Matter Alliance, and has been featured in Rewire, the Atlantic, Columbus Underground, and Columbus Alive. She has served as a full spectrum doula, home birth midwife and assistant, consultant to various organizations, and is the mother of 3 young women, one of whom is with preterm infant. And then we are also joined by somebody who I have met, Dr. Pat Gabby, the founder of Moms to Be. Her lifelong focus has been on improving the health and well-being of infants, children, and their mothers and fathers. In 2010, she received a grant, support from Ohio State, to begin a neighborhood project with cooking, nutrition, and social supports. Moms to Be for pregnant women living in high-risk neighborhoods in the Wheeland Park area. The success of this program to help mothers and women have healthier pregnancies and healthier babies has allowed Dr. Gabby and her team to expand to 6 sites in Columbus neighborhoods. Over the past 10 years, they have reached over 3,000 pregnant women. Moms to Be is the lead entity for CelebrateOne, the Greater Columbus Infant Mortality Consortium. This consortium has successfully reduced infant mortality in the African American community. And again, we continue to work with Dr. Gabby and Moms to Be to lessen that gap, not only in Columbus, but in the county as a whole. In December 2019, Governor DeWine granted funds to expand Moms to Be to Dayton and Montgomery. Because of the success here, we are allowing our partners, and our partners are allowing to go to other parts of the state. And then finally, we have Edward Johnson, Director of Public Health Policy for Columbus Health Department. He has a broad range of experience in public policy research related to economic development, education, public safety, and taxation matters. His formal training in economics and international experience in the field that has allowed his work in labor economics in South Africa, policy assistance in the Ohio House Ways and Means Committee, and serving as the House Democratic leader's confidant. Mr. Johnson frequently assists in evaluating strategies for potential and actual legislative initiatives. I want to thank each and every one of our panelists for joining us here today. I'd like to begin to hear from our General Assembly members. Representative Crawley, I know that you and other members of the Ohio Legislative Black Caucus have proposed and are moving several pieces of legislation that, if passed, would help our moms in Columbus and our surrounding areas. Can you provide a brief overview of that work?
Absolutely. Thank you for that introduction, Director Stapleton. It is good to meet you. Look forward to meeting you in person. And it's always good to be here with CelebrateOne and my other panelists who have been working really hard in the maternal health and infant mortality space. As she said, I am State Representative Erica Crawley, representing Ohio's 26th House District, East and Southeast Columbus. I am a freshman legislator ending my first term. And as soon as I came into the House, got right to working on maternal and infant health issues. It is something very personal to me as a mother of twin girls who went into preterm labor at 18 weeks, was on bed rest in the hospital, and had to have an emergency C-section at 34 weeks and complications after that. So these things and this issue is near and dear to my heart. So briefly, as was pointed out, I am a co-founder of the Black Maternal Health Caucus. We have several pieces of legislation. One piece of legislation is House Bill 434. And I know that there's a slide that'll be coming up that has some brief descriptions about the legislation, but introduced last year around this time, House Bill 434, which is the Pregnancy Associated Mortality Review Board modification. So Leader Amelia Sykes started the work on codifying PAMR board into legislation. Department of Health created the board in 2010, and they have been very delayed on producing reports. So last year during the operating budget, I was able to get an amendment into the budget that codified PAMR and requires reports to be issued every 2 years on maternal mortality and morbidity, as well as disaggregating data so we could really get down to the heart of what are the direct and indirect causes linked to maternal death, and especially for Black women, as the last report indicated, 56% of the pregnancy-related deaths were preventable, with Black women making up 17% of those giving birth, but made up 34% of the deaths. So we know that Black women are dying in this state at a rate of 2.5 times that of white women. So PAMR board puts some teeth to the bill that we were able to get into the operating budget, and requires yearly reports, as well as identifies who should sit on the board, not just experts. Obviously, they are important, but we also wanted lay members from the community who have dealt with maternal morbidity or maybe mortality, doulas, midwives, and people who had domestic violence situations, just so we can get a different perspective. So that's House Bill 434. We also have House Bill 435, which is Save Our Mothers Act. And what that bill essentially does is help bring Ohio into a place where we are an AIM state. And AIM, AIM, stands for the Alliance for Innovation on Maternal Health. And what this is a series of patient safety bundles that hospitals can implement to reduce things like hemorrhage, severe hemorrhage, or hypertension. There are also things around cardiovascular or vascular disorders or issues that arise and complications. And there is a bundle that addresses racial disparities and birth equity. And so also that bill calls for continuing education credits around racism, cultural competency, learning about birth equity, and that is for doctors and nurses and anyone who is coming in contact with a birthing person. The next bill we have is House Bill 611, which is Medicaid reimbursement for doulas. That was introduced by myself and Representative Paula Hicks Hudson earlier this year. And obviously, it's what it says, making sure that we have Medicaid reimbursement for doulas. Currently, Medicaid in the state pays for a little over 52% of our births, and doulas are not reimbursed. And we know that they are a vital part of a birthing team, and especially for Black women and women of color across the country, we see how having a doula as part of the birth team reduces the need for cesarean sections, lesser stays in the hospital, a lower need for medication, and just an improved, healthcare experience when it comes to pregnancy and birth, whether it's preconception, during pregnancy, and postpartum. And I know my good friend Jessica Roach will talk all about Root and doulas and the importance that they, have in, the birthing experience. The next bill is House Bill 620, which is health and equity in all policies that I introduced that, really talks about how we have codified discrimination in our policies, and that in order to mitigate some of the damage that racism has caused, we need to look at the policies that we are implementing and making sure that we are not perpetuating racism. And so that will call for health impact statements to be produced, just like we have fiscal notes here at the legislature. Fiscal notes talk about the impact to the state. Health impact statements will talk about the health impact to a certain community, whether it will have a positive impact, negative impact, and neutral impact. And then it calls for an interagency health equity team where all of the state agencies will identify a person to serve on a board to look at how our agencies are really addressing health equity in a responsible way. And I just want to say briefly, House Bill 434, 435, and 611 have companion bills over in the Senate. And I know Senator Kunze will speak to those because those bills are moving over there, and I'm happy about that work. We also have House Bill 91, which with the Boggs and Boyd, that creates a family and medical leave program that was talked about a lot this year dealing with COVID, and just how women are usually caregivers even prior to COVID and how that's impacting the workforce. But even from, a birthing space or just taking care of our aging population, women tend to be the primary caregivers. And we should not have to make the hard decision between, taking care of our family or having to go to work and not being able to provide that care. So House Bill 11, which helps to improve prenatal and maternal health outcomes, that did pass, and that is in law. And that talks about smoking cessation. It makes sure that Medicaid can provide 2 dental cleanings, which is vitally important, instead of 1 during a pregnancy. And then, has a little bit of funding for group pregnancy. And then we have HCR 15, introduced by Representative Ingram, urging the U.S. Department of Agriculture to allow states greater flexibility in administering SNAP benefits. Obviously, states know what is best for our state and the community, and there has been some initiatives at the federal level to rein in SNAP benefits and take those benefits away, and they make a huge difference in the state, especially for birthing people. And then we have HCR, House Concurrent Resolution 31, with myself and Rep. House, which is declaring racism a public health crisis. I applied City Council, Columbus City Council, as well as Reynoldsburg and others across the state, local governments really taking the initiative to declare racism as a public health crisis and looking at ways to mitigate that damage and moving forward, but we have not done it as a state. And we absolutely need to. We cannot address racism until we identify it, call it what it is, and then put in policies that help all communities, not just certain ones. And so that's what we have going on briefly at the state. And I know my good colleague, Senator Kunze, will talk about what she's doing, but Black Maternal Health Caucus, we are working on another package of legislation. Don't want to reveal it right now, but it is big and will identify some other gaps like transportation, daycare, and things of that nature. And we'll roll that out soon. So thank you.
Thank you, Representative Crowley, and thank you for all that you're doing to move this subject forward. Really, really critical. So thank you. Senator Coons, you have a unique perspective as both a legislator and a policymaker through leadership of the Ohio Infant Mortality. Can you provide us with a brief overview of your legislation and policy work?
Yes, thank you, Director, so much. It's so nice to virtually meet you. It's great to be with all of you today. I'm grateful for the mayor, for CelebrateOne, for this impressive panel, and for our partners on all different levels as we try as a state to really lift the entire state. The work that you do on the ground, grassroots, every day is so vitally important. And I would be remiss not to give my colleague, Rep. Crawley, just a great shout out for her work, her leadership. We're so grateful for you. And I am honored to carry companion legislation in the state Senate on the bills that Rep. Crawley just detailed. I will give you a quick update on the Senate side. Senate Bill 326, which is the companion to 434, is receiving a second hearing in Senate Health Committee today. Senate Bill 327, which is the companion to 435, House Bill 435, is also receiving a second hearing today in Senate Health Committee. And thirdly, Senate Bill 328 is receiving a second hearing today in Senate Health Committee and is also starred for a possible vote, which I'm looking forward to hopefully seeing that pass quickly through the state Senate so we can get it back to the House and really help Rep. Crawley get her bills done before the end of this General Assembly, because they're really of vital importance. As the chair of Infant Mortality Commission these last few years, and being fortunate enough to serve on the commission where we did a lot of data collection when I was in the House, we did see that the social determinants of health, the racial disparities, are really what are causing the disparities in the outcomes, the birth outcomes for our babies, and the outcomes that we're seeing for Black maternal health as well. And so being able to, as Rep. Crawley so aptly put a name to what we are seeing and really come and scale back the layers of bureaucracy and say, what are the key things that are missing that we need to invest in that will help not only all of our babies reach their first birthday, but really address this gap in disparity with our African American babies. And I will just say, I'm a mother. I have two daughters. I care about families in our state. I think this can happen to any family. I have a cousin who's African American. She had a preterm birth. It was very touch and go for her baby as well. And so I take this charge very seriously as the chair of the Infant Mortality Commission. We virtually had a meeting last week or 2 weeks ago, and where we had an update from the Ohio Department of Health, Commission on Minority Health, and Department of Developmental Disabilities to talk about home visiting and what's been happening during the COVID-19 pandemic to ensure that our families are still receiving the service that we voted for, that the governor so courageously and aptly and rightly put in our budget. It was, I think, one of the largest investments in early childhood was made in that budget last year. It's something I was proud to vote for and proud to support, and will continue to fight to keep, regardless of what our state budget looks like going through the economic crisis that's associated with COVID-19. And it was really great to hear from our partners across the state that the work has been continuing, that telehealth has stepped up and started to meet needs. We know it's not as maybe as positive as an in-person visit, but it is something that it's not falling completely off the cliff, which we're very grateful for, the work that continues. Lastly, I will say we had Senate Concurrent Resolution 14, which is introduced by my colleagues, Senator Craig and Senator Williams, to declare racism as a public health crisis. And that bill has had 2 hearings in the state Senate Health Committee, and I expect it to hopefully have a 3rd hearing but soon, hopefully the next time we meet. But again, one of the things that we're looking forward to as a member of the or members of the Commission on Minority or on Infant Mortality, sorry, all my commissions, we are looking forward to getting input from our stakeholders, from our grassroots around the state on what else we can do to address minimizing the disparity for African American babies and for mothers. So we're looking at potentially extending Medicaid coverage for an additional up into a year postnatal. We're also looking at making lactation consultants Medicaid eligible. And like Rep. Crawley, I have another bill that we've been working on that's not ready to roll out yet, but may or may not be part of the Infant Mortality Commission overhaul bill. But we are really focused on practical ways that we can get to the heart of this issue for Ohio's families. Thank you so much for having me today.
Thank you, Senator Kuntz. And this next question really gets to what you just talked about. You know, what can we do? Oftentimes you need support, right? You need support from policy organizations and people and organizations around the state that are doing that are supporting the work that you're trying to get accomplished. And so I know this morning we sent over support for Senate Bill 428. I don't know if it was on the House or the Senate side, but I know that we are supporting Medicaid for doulas. And so that's something that I know that we immediately responded to when we heard that the bill was coming up. So can each of you kind of describe, regarding the current bills that are out there, how can we help support the message?
So I could start and say, I think, you know, what you did today by offering testimony on bills that, you know, are in hearings, that obviously makes a difference. So us as legislators know where you stand on these issues. But I will also say that before, when things aren't moving or come to committee, you know, those are companion bills that are in the Senate. Some of these bills have been, you know, introduced from last November and have not had one hearing. And we all understand how important Black maternal and infant health is to this state. And we know what the disparities are and what the rates are looking like. There's no reason why these bills are just sitting. They've been referred to committee and they're sitting and with no action. And if we moved on these and implemented them into law, it would save lives. And so even when things are sitting, we could use CelebrateOne, or other organizations writing letters to the president of the Senate or Speaker of the House or the committee chair saying these things are important to, you know, our community members. They will save lives. They will make a difference. You know, it is kind of like a dereliction of duty, I say, that when we sit on these things and don't move on them, and then the impact is not felt. We should be doing that too. Always, you know, coming together and offering support to say, hey, these things need to move. But like I said, offering testimony when the commission meets, you know, providing an update from CelebrateOne or Moms to Be, or have, you know, one of the members of Mom to Be who shows up to let us know how the program is making a difference, or, you know, where are some gaps, or where can the legislature step up in its support of your program as you know, work with community members. And I know Ruth will talk about it. She's been instrumental, Jessica, with Senator Kunze's office, as well as mine, giving a real feedback on, you know, what pregnant women are going through, what support is needed, and where there's gaps. Senator Kunze.
Rep. Crawley said it very well. I think obviously staying involved when you can, following the legislation that you care about, advocating for it. But really, I think some of the things that you see in your daily practice of serving women and families, that where, like she said, where there are gaps, what else is the state not doing that would help lift the people that you're serving and help you as an organization better serve? So I think those are kind of the key things. Obviously, adding your testimony and members of the public that you've served, their testimony is really a powerful way to tell the story. And I think that's those are the best things that can be done.
And each of our policy partners can do that. Everybody on this call today can play a role in that. And so that's really important. Once passed, how soon does legislation actually take effect?
So most legislation, once passed, has a 90-day waiting period, unless it's passed with an emergency clause. If it has an emergency clause, it takes effect the day the governor signs it.
Okay. And C1 staff, at this point, are there any questions in the chat that you would like to share? Any questions before we move on?
No questions yet, Maureen. Thanks for checking.
Okay, good, good. Senator Kunze, I believe that you're due in committee shortly and will need to leave us. Are there any final thoughts or reflections that you'd like to share before you leave?
Well, I just want to say thank you so much. I think one of the other things that is so important for our work here at the state is what you're doing today too, just bringing the stakeholders together, having an update, and really hearing from each other what's working and what's not. We know that each zip code hotspot that we have is different. We know there's not a magic silver bullet to solving this complex issue. We know that race plays an enormous part, and I think really being able to voice that, to say that there are inequities by zip code, each zip code is different, and bringing us sort of your unique needs and challenges as well, is really going to be instrumental in us being able to work together to eliminate the disparities and help more of Ohio's children reach their first birthday. So I'm going to turn off my camera, but stay on for a few more minutes to listen until I have to go to committee. But I'm just so grateful for the ability to participate today and for all of the work that you are doing across our community. We're so grateful. Thank you.
Thank you, Senator. We are appreciative of both you and the representative and your time here today. So now we're going to move on to hear from some of our community partners who really play a key role as well, Root and Moms to Be. Jessica, I understand that Root is a Black women-led reproductive justice organization that works as both a direct service provider and an advocacy agency. Please share with us an update on your work.
Well, thank you very much, Director Stapleton. I'm very excited about having the opportunity to meet with you personally and having the opportunity now to e-connect. Thank you so much for having us on. Yes, so to give you a brief overview of who and what Root is. Root is a collective of concerned Black families, community members, and advocates, as well as interdisciplinary professionals dedicated to decreasing Black maternal and infant mortality in Ohio. Our organization in and of itself has been around for about 3.5 years, but collectively between myself, my partner, Dorian Wingard, and our now 12 core group of perinatal support doula specialists, we bring close to 50 years collectively of experience. Myself being in the maternal health space for over 20 through both clinical advocacy, clinical direct service work while I was nursing, and now as a maternal child health expert with an MPH that practices very specifically in Black maternal health. And so for us, what it is that we do is we work across the board. We understand and know and have been having this conversation for a much longer period of time than what we've even been seeing now in the more popular media, talking about racism as a public health issue and actually directly looking at racism and how it has a negative physiological impact, in particular on Black maternal, infant, and family health. And so we address it from that perspective. We know as a Black-led, very specifically an independent and autonomous Black-led community-based organization, that one of the things that we can do to help establish the best care is to be able to make sure that we're serving folks that look like us and making sure that our organization reflects that as well. And through that practice of being clear and bringing all of these entities together and being able to support our folks from a perinatal support place, meaning we do preconception, we help with family planning. We're there from the beginning of prenatal care. We actually often have our clients come to us before they have been able to find a physician or a care provider that they would like to have. And so we refer them to those who are on our preferred care provider list. Being able to work as a team and an integral part of the perinatal support team, we currently have a standing 0% maternal and infant mortality rate. We have a very low comorbidity. Our NICU visits are minimal. I can literally say we have a handful of our babies that have had to engage the NICU at all, and it's typically anywhere between 48 to 72 hours before they're discharged. Our preterm rate is less than 5%. Our low birth weight is less than 3%. So our babies make it all the way to past 39 weeks, and they typically weigh over 7.5 pounds. Our averages is around 8 pounds, to be perfectly honest with you. And what we have found and what we know and what we're clear about is that we trust the internal resource that we have. So we provide not only levels of advocacy for our clients, but we also help bridge the gap with healthcare providers to directly address the issues of racism in healthcare communication, how it is that it impacts how it is that we are cared for, how it is that it negatively impacts our physiological processes. And I think that you can see through our work, and the more that we have an opportunity to be able to directly address our community, you can see through our work how it is that our program works and how it is that programs like ours across the country that have similar rates show the same thing, that when you are a Black-led community-based organization, when you have the personal experiences like myself, and you mentioned in my intro, I am the mother of a preterm infant, and I was a mother of a preterm infant after I had all of the social determinants of health addressed. And we know that it's not just the social determinants of health, it's stress that directly impacts the physiological development throughout, not only throughout our entire lives, but definitely in that maternal health space and when we are when we're growing our own babies, right? So it's important to be able to have that be reflective. It is important to be able to address that with our community and to be able to provide that level of advocacy so that we can reach a re-empowerment of Black parents and families. We don't like to talk about it from a perspective of empowerment because then that means that something has to be done for us. And I say us as a collective because, again, speaking as a Black woman that has had these experiences, it's very personal for me. It's not that we need someone to come in and save us as much as it is that we need someone to work directly with us to validate our voices and keep them at center. So our program is entirely family centered. It is family oriented. It is family directed and led. We believe in informed decision making, not just informed consent, meaning that we take the time to provide that education and advocacy with our clients to help answer and fill the gaps. And again, what we have found in doing this is that we have been able to achieve, and we will continue to work towards, even higher levels of standards in our direct care and our direct service, as well as policy and advocacy development and support. But we want to continue to see the trend that we have had. And one of the things one of the beautiful things that has come out of it now that we are in year 3 is that when we have returning parents that are coming to us, that came to us for their first children or maybe their second children, and their birth experiences are very different with us as an organization than they may have been without the assistance of having the perinatal support doulas. And that we're also seeing that our root community is developing its own village, and which is always the goal. So our families have become connected with one another. They help provide support to one another. We now have peer-to-peer counseling that occurs within our organization. All of our perinatal support doulas are trained in breastfeeding education, as well as 6 of them are currently certified lactation consultants. So we are really able to provide that level of support from a nutritional component, from the mental health support component, from the clinical perspective, from legal and ethical advocacy, to be able to provide more of a holistic perspective in care from preconception clear through postpartum phase. We're lucky enough to have an education specialist on board with us in our organization, which means we're able to support families if we do see that there are any type of developmental delays that may be of concern to the parents. Our education specialists, we are able to follow them through and up to 5 years if necessary. So we're very excited about the role that we play in helping to address this disparity cap and really truly establishing what we consider health equity, and look forward to moving forward and continuing the work in our community so that we can get to the place where that health disparity gap is actually eliminated in Black families.
Absolutely. Thank you, Jessica, very much. We're going to move to Dr. Gabby. Moms to Be is an innovative community-based pregnancy program for low-income women established by The Ohio State University in 2010. Dr. Gabby, please share with us an update on your work.
Thank you. Thanks to all the presenters too. I'm so happy to be here with everyone and everyone with a mission to eliminate Black infant mortality, eliminate the disparities in Black infant mortality and reduce it overall. And as Mayor Ginther said, he came to our Wineland Park church, Grace Missionary Baptist Church, in about 2010 when we first started cooking in the kitchen in that really predominantly Black neighborhood with an infant mortality rate of over 15 per thousand. And most of those were Black babies that died. And I had been on the governor's Ohio infant mortality task force and learned all about all the reasons. And I was so shocked that so many Black babies died. I'm a pediatrician and I had taken care of so many Black families in Nashville and Boston. And I admired these moms, these dads so much. I just couldn't believe that we had such a high Black infant mortality in Columbus. And when we started here, I think it was 17 per thousand Black infant deaths in Columbus. I was so annoyed, I must say. And I said, we've got to do something about this. I want to learn from our Black moms. I know it's a pregnant Black urban mom that is most at risk. And so working with some of the leaders, I'm proud to say Joyce Beatty, Yvette McGee Brown, Teresa Long was Columbus Public Health. They all were my sounding board and gave me guidance. And I can say, back to what Jessica said, the stress was overwhelming for these moms. And so at first I said, let's have a spa for pregnant moms in Wineland Park. We settled on cooking and nutrition because stress and nutrition are two key components to the disparities, along with a lot of other issues. But we've learned over the last 10 years that and it's more than just the medical component, it's more than just the social support. Infant mortality is a direct reflection of the health of the neighborhood, the health of the community. That's why we need everyone involved if we're going to solve this problem. And I think we've made a good strides here in Columbus with all of our partners. And I wanted to go back to what the goals were for CelebrateOne and how we met them, and in terms of connecting the disconnected. We located in a church in the Wineland Park neighborhood. Then we've expanded. We're in 6 churches, and then Mount Carmel West, Franklinton meeting room, and at OSU East in a hospital meeting room. So we're in 8. They're all the CelebrateOne priority neighborhoods. So we're right there. We're community-based, and it's a group model. So Twinkle Schottky co-founded this with me. She's an infant mental health specialist, which I had never heard of, and I'm a pediatrician. But she said, the moms are depressed. If we can help them get dressed, walk out of the house, bring their pregnancy, then after they deliver, bring their baby, and get into a group support with other women going through the same life course, where they are in their life course, we can build support groups among the moms, like Jessica mentioned. They can be more mentors, and they will learn and teach us. So we are a group model, and before COVID, we saw 120, 130 moms a week. When the other reducing preterm births. So now we have some very good, rigorously researched outcome data from our Ohio State biostatisticians, and we've significantly reduced infant mortality. We've significantly reduced preterm births, especially very preterm births, which are the primary contributor to our high disparities, because Black women tend to have many more very preterm births. And then we've significantly, again, I think we're reducing racial disparities because over 70% of our moms are Black moms. So that was our original goal. Can we attract and engage Black women? Will they come? Do they want to come and stay and be with us and teach us? And the answer is yes. So in terms of how do we achieve those reductions, making sure they get into prenatal care, as Jessica mentioned, making sure they get support for breastfeeding. One of our early findings was the significant uptake in breastfeeding. And I just wanted to read a quote from one of our moms. We interviewed them 5 and 6 years afterwards. And this mom says, "I never breastfed my other 3 children, but during Moms to Be, I learned how healthy and stuff it was. And I breastfed my baby until she was a year because of everything I learned in the program." So that's just one of the interventions that we know reduces disparity. I've got a lot of other things that we can talk about, but I know, there may be questions, and I'm happy to answer questions.
I actually do have a couple of questions for both of you, and I'm going to combine a couple of questions. What are some of the biggest challenges in delivering the services to moms, especially in light of COVID? What are some of the biggest challenges, especially in light of COVID?
Well, while I'm on, I can just say it's a huge challenge because we were always, huggers and seeing our moms in person. And when I say huggers, everyone gets greeted with a hug if we already know them, with a high five, and all their children come to our Moms to Be sites. So, and then I forgot to mention the Dads to Be is a huge part of our program, again, to help eliminate disparities and improve the community. So we can't do that right now. And we have, actually, we're doing pretty well in enrolling moms virtually before they've even seen us. We've had 24 new enrollees last month and 24 this month, or the last 2 months, which is almost one a day during, business day. So that's a challenge, but getting our food to our moms, getting our supplies to our moms, making sure that our moms are healthier and happier, and learning about their pregnancies and what we have to teach and hearing from them. We do have, I need to say, we have 10 Zoom sessions a week. And one of them is for moms with children. And then the other ones are the curriculum that we've developed, listening to the moms. And the moms join in, and that is reaffirming for us. And it also is helping identify issues, because then during the week, there's individual check-ins with nurses, social workers, nutritionists, community health workers, navigators, child development specialists. So we still do individual case management, but we miss them.
So,
Yeah.
So, yeah. So for us, it's really clear actually what was the biggest challenge of COVID, because we were lucky enough that transitioning into telehealth wasn't as much of an issue for us, because we had already been practicing some of those modalities, even though they weren't necessarily recognized as part of some of the home visiting. We had done that as part of our own original model, simply because we knew that we needed to be able to meet our families and our communities where they were. And sometimes it was just easier to be able to facilitate that through video conferencing. And so when we had to start shifting that as a whole for the organization, we really didn't have much of an issue. We made sure that we shifted our very small budget, because again, we're a community-based organization, so we don't necessarily receive the same resources that other state and local agencies do. But we made sure that we reallocated those resources to cover our clients that may not have had the opportunities for technology in that way. So we made sure that they had that. We also made sure that we purchased an abundance of at-home equipment, so folks were able to monitor their own blood pressures, folks were able to monitor their own temperatures, folks were also able to monitor their babies. So we did telehealth with each one of our clients to teach them how to utilize a Doppler so that they could actually listen to their baby's heart rate on their own together. And because we are so family-centered, we don't have separate programs for moms and dads. We make sure that that comes together as a unit, as well as multi-generational when we have grandparents or aunts, the various ways that Black families show up. So we make sure that that whole family unit is included.
Mm-hmm.
And that the biggest challenge that we had actually was when the hospital systems shut down and stopped allowing doula support. And even with some of the push and support that we had from the Ohio Black Maternal Health Caucus, in particular, Representative Crawley, support that we had from the executive order from the governor of New York stating that perinatal support doulas were actually an integral part of the perinatal care team and that they needed to be allowed into the hospitals. We just recently, over the last week, have been able to go back in. And one of the consequences that we have seen, very unfortunately, but very clearly, because we are a public health research-based organization as well, so we keep track of all of our stats, is that we saw an increase in scheduled inductions and C-sections, which is something that we had not previously had with our patient population due to COVID and due to not necessarily being able to do some of that direct advocacy. What really came to light was that our preferred providers that we've been working with, that have been working with us over the last 3 years, were in it with us, and we were able to make sure that our clients were able to have the best possible care. But those that had not necessarily been involved and engaged in work with us, we're coming out on the other end understanding that there is a great deal more that needs to be done as far as advocacy and health communication, because quite frankly, and to be perfectly honest, the rates of inductions and the increased rates of C-sections that we're seeing without the medical indication or clinical indication necessary is a challenge. It's a challenge, and it's a real travesty for, in particular, Black community that is already dealing with some of these disparities and some of the disproportionate medical interventions that occur. So we're hoping now, with being able to re-engage the hospital systems, we had a couple of real champions inside of, in particular, OSU that kept pushing for us, and also at Mount Carmel Health Systems that kept pushing for us, with us being able to be back in person with our clients, of course, utilizing the necessary PPE and protection. We're hoping that we're going to be able to start reversing that trend that we started to see during COVID.
Excellent. That's really important. What strategies are you currently implementing to address the social determinants of health? And have you observed successful outcomes that you'd like to share with others? I think you've mentioned a couple, but if each of you could expound on that, that would be great.
Well, housing is a huge issue. 25 to 30% of our moms are in unstable housing. And, we have a fair number that come from Van Buren, from the homeless shelter. So housing is a critical need. And the housing, of course, is also, a lot of the evictions are related to not being able to pay utilities. So now during the moratorium, up until the moratorium, we felt safe. Now we don't know what's happening. And so evictions are a huge issue. I just have to, I'm sorry, I have to comment on what Jessica said. Dads to Be is an integral part of our program. The dads are part of our sister-brother circle. We're an integrated program. I didn't mean to say they were separate. We're integrated because early on, one of my thoughts was, if the dad was involved, they could help pay the utilities. They could help pay the rent. They could help buy the groceries, because food, transportation, and housing are serious issues for our moms.
Thank you. Jessica?
Yes, ma'am. Thank you. So when we're talking about the social determinants of health, we actually have to take a step back, because the core foundation for Root is really taking a look at the structural determinants that have created the consequences of the social determinants. So our patient population is actually split probably at this point about 60-40, with those that are within the lower socioeconomic groups and those that are within the higher socioeconomic groups. And what it is that we've seen in those trends across the board, as well as what is reflected from most recent CDC and March of Dimes reports is that it's not just addressing access to affordable housing. It's actually having to address redlining and access to being able to have home ownership, and how it is that affordable housing or a lack of affordable housing has continued to be perpetuated inside of systems. It doesn't necessarily mean that we don't do direct things like helping with finding rental assistance or providing rental assistance ourselves, or actually looking at providing the resources and doing the case management with making sure that folks are connected to resources so that utility bills can get paid. We do emergency food services as well. We make sure that we fulfill basic items like diapers, wipes, formula if necessary, although we have a really successfully high breastfeeding rate. So that's one of our lower commodities that we need to actually do. But we are also doubly working with organizations to address some of those legal ramifications, in particular inside of Franklin County, that has the highest eviction rate in the entire country, but has separately a code enforcement court that doesn't get addressed as quickly. So often our clients that do have issues with some of the unstable housing are getting caught up with landlords that aren't meeting the requirements for code. And in the meantime, the rent isn't being paid. And so they're getting evicted before the landlords are actually being held accountable. And so the cycle just perpetuates itself again. So we have to look at it from across the board. In addition to that, and I want to be really clear, because again, this is something that we don't discuss often when we're talking in particular about Black family health. We talk about us as always constantly being in a state of despair. But the reality is that even when education is met, increase in income is met, all of the basic needs are met, all of those social determinants of health are met, we still have the same health disparate gap, if not more. And most of that has to do with, again, the level of stress and the impact of racism, because we're closer to those institutions that have actually created it. If you're talking about having the Black experience in a workplace, it is often that you have to work at 120% versus your white counterpart. And there's micro and macroaggressions that happen every single day. And while it's more palatable to talk about us from a social determinants of health perspective, and again, that's not to say that we don't have these needs that need to be met. It is very obvious. You cannot neglect the relationship between racism, the structural determinants that have created the consequences of these social determinants, and the actual impact of having to deal with those stressors on a daily basis that impact our physiology, which is why it's so important for us that we don't talk about these things in silos. We make sure that we talk about them in a very holistic way while doing the direct service and addressing some of the social determinants, and also dealing inside of the advocacy and the need for mental and physical and spiritual and support when you are the Black professional working inside of these organizations that can create and cause harm because of some of these institutional and structural issues that we see.
Thank you. We're going to just shift a little bit. We have local policy advocates in our area who can share a variety of information, specifically discussing new and exciting announcements in public health. And so with us today is Edward. Edward, please share an update on the ongoing work at Columbus Public Health.
Thank you, Director Stapleton. And just to echo everyone else's comments, I look forward to, nice to meet you, and I look forward to meeting you. I think you'll be over at Columbus Public Health in the next couple of days. So yep, we look forward to spending some time with you. I think broadly why I'm here is to talk about the City of Columbus's new Center for Public Health Innovation, but also how that ties into public health policy and Black maternal health. Just as the primer, and I'm sure everyone's heard, back on February 14th, in a different world at a different time, Mayor Andrew Ginther declared racism a public health crisis here in the city of Columbus. And then who would have known, but 2 weeks later, a pandemic came to our front door that we had to deal with. And so a lot of things got put on hold, but this is something that Dr. Roberts, our health commissioner, said, we've got to get this stood up. This is too important. And we're seeing the consequences of racism as a public health issue even play out through this pandemic. I think we're all aware of kind of the national attitude, what we sense we know, but what we do know is that here in Columbus, we are fully aware and we know that African Americans are contracting COVID much more than non-Hispanic whites, more than Hispanics, but at a rate, we're also twice as high as non-Hispanic whites. But our Hispanic community is twice as high at the rate of contraction as our Black population. And so that's something that we started to see come out. And so we decided we need to get this Center for Public Health Innovation stood up, established, and starting to work to deliver recommendations on what can we start to do to address racism as a public health crisis. So at its core, what we're looking to do is to increase life expectancy by and raise the quality of life by reducing health inequities. This is really born out of something that I think we all know, things that when I've had discussions with folks across the spectrum, the political spectrum, the social spectrum, they know. And when you articulate it, I haven't had a single person disagree. I say, do you think African Americans in Columbus and in the United States live shorter lives than their white counterparts? Everyone says, I do think that's true. And it's, do you think their quality of life is also lower? And they said, that's probably true too. And so for our perspective, a lot of that goes back to the health inequalities that are experienced throughout a lifetime, but have been built over 400 years of our society. And so our first step was to join the Government Alliance on Racial Equity, GARE, to say, we're not in this by ourselves. There's an alliance of state and local agencies that are looking to address this, whether it's through racial equity impact assessments, so that every department across the city is looking on the front end at the impact of a policy, not just saying we're going to try to apply this equally to everyone, but saying if we do that, there will be a disproportionate impact on very specific groups if we do things that way. And so I'm really proud, and I know I'm joined on this call by my colleague, Sue Ellen Bennett. She is actually our executive officer for the Center for Public Health Innovation. She's an epidemiologist by training, because we want to make sure that data is what's going to inform a lot of these policy interventions. One thing that I'll give you as an example that we see as a policy that's really harming African Americans, it's harming African American women, and it's harming African American mothers very specifically, is when we look at a topic like smoking and tobacco usage. Here in Franklin County and Columbus, we know that there are 160,000 tobacco users. That's about a 13% tobacco usage rate in our county, much better than it is off of its all-time high in the 40% range, but still not great, 13%. But of that 160,000, you take it down another notch, we know that 100,000 of those smokers are African American. 100,000 out of 160,000 smokers are African American in our city. The one thing that we're going to really focus on, because we know how these conversations can go, is we started to look at why is that the case? Why are there so many more African Americans using tobacco? And it goes back to things like flavors. Specifically, it goes to menthol and mint flavored tobacco usage. We know that 60,000 of that 100,000, the tobacco product of choice is menthol or mint flavored. And so when we start to look at policies, we start to say, this is not an accident. This is not something that just happened over time and, oh, woe is us. That's just the way the world is. That's something that's shaped by targeted marketing. It's something that's shaped by saying, let's put the most palatable form of a very addictive product in front of a very specific group of people. So choices were made over time to create that situation and that circumstance. So we need to make new choices informed by data to say, how are we going to change that policy? How are we going to make folks healthier? The reason I bring that up is because you can't bring someone from public health on a call without talking about the pandemic that we're currently facing. So why do I bring up smoking? Why do I bring up flavored tobacco? We know that smoking upregulates the receptors that COVID-19 binds to in the respiratory system. So that's a way of saying, if you smoke, it's easier for you to get COVID than if you don't smoke. Makes mitigation much more important. What we're seeing is, and as I said, African Americans are contracting COVID more than non-Hispanic whites in our community. We also smoke more. The tragic thing that we're seeing is we're seeing a lot of African Americans land in the ICU. Last time I checked, and I'll have to update these statistics, so please don't hold me to them, but last time I checked, it was Black women that were landing in the ICU most consistently. That's a really tragic thing, And we have to imagine that some of those are mothers. The Ohio Disease Reporting System at times makes it difficult to query all of this information. I'm sure if you follow the governor's press conferences, you've heard of the challenges that we have around that. But that's why these are the types of policies that have really come to light in the pandemic. I think as we talk to everyone on this call, and I know there are many colleagues from our Family Health Division, from the Center for Public Health Innovations. We have many epidemiologists from our department on the call. These are things that they all know. I'm preaching to the choir, if not saying something that I'll probably get an email saying, well, you quoted that wrong. That's not how that statistic goes, but we get what you're getting at. Those are the types of things that we're going to start to look at and that we're going to start to bring to the fore and that we're going to recommend to the mayor. If you really want to increase life expectancy, if you want to raise the quality of life of Black and brown folks in Columbus, Ohio, these are the types of policies. They're going to have to be very specific, very big and broad interventions to say we need a healthier community. Moving forward, we're also going to be very cognizant about where and how COVID-19 testing is offered in order to ensure that we're addressing the needs of our CelebrateOne neighborhoods, knowing that the contraction, the case rate in our CelebrateOne neighborhoods is higher than our non-CelebrateOne neighborhoods. But we know that the hospitalization rate for COVID is over 2 times as high in our CelebrateOne neighborhoods. How do we do monitoring? How do we offer testing? How do we offer standard vaccinations, which we know have dropped off since the pandemic started? Our fear in public health is we don't want to see a comeback of other things that we thought we had the lid on. We want to make sure folks are getting all of their traditional vaccinations. And that's something that's going to be tremendously important for maternal health and for child health.
Thank you very much. What community partnerships are you engaged in to support Black maternal and infant health?
So I think our most important community partnership is with CelebrateOne, first and foremost. I'm always going to put that plug out there. Our family health team is always out there in our community, whether we're working with Nationwide Children's Hospital, whether we're participating in these types of forums, Moms to Be, Root, whatever that case may be. So we are always looking to make sure that we're getting to moms, that we're getting to kids, that we're using every avenue to be as aggressive as we can to encourage good public health and to stand up and to support that. Additionally, I know we're setting up kitchen cabinets and advisory boards to help our Center for Public Health Innovation. And so we're trying to make sure that has a good cross-section of folks, whether it's academia and community involvement. I know that there's been a lot of interest around this topic, so we're always looking to dialogue and interface with folks as they're willing to work with us.
I hope that the partners on the phone are hearing that and will reach out to you if they want to participate, because the more voices you have at the table, the better off it is for everybody. So I'm certain that and hopeful that people are taking note. I'm going to ask staff again, are there any questions in the chat box that you'd like to share at this time?
Thanks, Maureen. We actually did have a question from Christine Garcia, and she states, she represents families in our New American communities and would like to know the best way to connect with moms to be.
Oh, good. I took myself off mute. Yes, there's several ways, but the easiest one for me to remember off the top of my head is email moms and the number 2, capital B, at OSU, M as in mother, C.edu. And then we could send, I'm sure that we can figure out how to send that on chat or email to her. But moms to be at osumc.edu. That's answered every day, and we can, I've got friends who are sending it out. Oh, good, thank you. And now that I have the mic, could I also bounce in with what Edward said about smoking? Because I just looked at my moms to be versus all of 4 or 5 years of Franklin County births, and moms to be were 38% were smoking pre-pregnancy. That's very high, but 13%, I guess 17% of pregnant women overall in Franklin County were smoking. And Columbus Public Health has a great My Baby and Me tobacco-free program, and it is really excellent. So I'm encouraging everybody to make sure our moms are connected to the Columbus Public Health Smoke-Free for the Baby and Me, because they give incentives. I think, you connect, but you get diapers. I think you can get a whole year's worth of diapers. So they have a fabulous program, and we should take more effort, especially as Ed mentioned. COVID is setting the moms up for, and smoking setting the moms up for more severe COVID. And we have had moms with COVID, and we've had babies with COVID. So we have to really, again, focus on stopping smoking too.
Thanks, Doctor. Any other comments on community partnerships worth talking about? Hearing none, I am going to turn this over now briefly to Priyam, who will share some updates from CelebrateOne, specifically data updates. Priyam?
Sure. Thanks, Maureen. So good afternoon, everyone. The first slide that you see here, first, I will preface this by saying I am no data expert. Our EPIs are in high demand right now during this COVID season and cannot be here with us today. So you get me, but luckily I've gotten some of their expertise. So the first slide here you see at the end of 2019, the infant mortality rate for Franklin County was 6.9 infant deaths per 1,000 live births. At baseline, the rate was 8.6, and over the last several years, there has been a slow but consistent drop in the overall infant mortality rate. So still much work to do. I think several panelists have addressed that we must address the racial disparity if we want to reduce the overall infant mortality rate. And I'm glad that we have advocates on this front as well as community organizations. Next slide, please. And so this slide really showcases that, however, the infant mortality rate in CelebrateOne zip codes is considerably higher than the county as a whole at 10.5 infant deaths per 1,000 live births. And the racial disparity in infant mortality between non-Hispanic Black babies and non-Hispanic white babies has not improved. So again, the point of addressing, Black maternal health, Black infants is absolutely critical to decrease our community's infant mortality rate. And, I think a lot of us have mentioned today very much a place-based focus. So where are the communities and neighborhoods or CelebrateOne neighborhoods that have the highest infant mortality rates? And how can we make sure we continue to invest programming, funding, and services to those neighborhoods? Next slide. And here you see Black babies are still 2 to 3 times more likely to die before their first birthday than white babies. I mean, this really just shows this is a sleep-related infant death data brief. And so again, we have a disparity issue here. I think overall we've been doing a little bit better on sleep-related infant deaths. We still clearly have much work to do. We have various programs that address this particular initiative, like our Safe Sleep Ambassador program. We are always looking to train folks in the community. We're always looking for folks to participate in our already scheduled training. So we'll make sure this group gets that information out to you all later today. So I think, and then the last announcement I have really is around this upcoming event this weekend, actually. We have Aaliyah Brown with us today with Senator Brown's office to share a bit more. So Leah, I'll hand you the mic.
Thanks, Priyam. And thanks for letting me be here today. This was a great discussion, and I was so thankful to be able to be a part of it. I'm the Deputy State Director for Senator Sherrod Brown, and Priyam, as she just stated, invited me to come on and briefly share with everyone information about the statewide virtual Black Women's Health Symposium that Senator Brown is hosting over the next 2 Saturdays. The symposium is going to focus on racial health disparities, with panel discussions and speakers addressing physical, community, environmental, mental, and economic health. After each panel, we're going to hold a virtual workshop where participants will receive tools that can assist them with navigating some of the barriers to health equity highlighted during the symposium. Additionally, we'll we're hoping that this symposium will be more than just a discussion, but will generate legislative and policy initiatives to address the barriers to health equity and lead to additional action on the local, state, and federal level. Please visit the link listed in the slide there to register. I will note that it's going to occur over 2 Saturdays, so it's going to be this upcoming Saturday, the 26th, as well as October 3rd. And so on each Saturday, we're going to have different panels and different speakers. And I would also just like to highlight that in addition to Senator Brown and speakers and panelists from around the state of Ohio, we will also have national leaders like Linda Blount, who's with the Black Women's Health Imperative out of Washington, D.C., and U.S. Congresswoman Maxine Waters, who is the chair of the Financial Services Committee in the House. She will also actually be hosting, or I should say, holding a discussion with Q&A on some of the issues brought up here today, like housing instability and income inequality. So with that, I would just say thanks once again, and I hope that you all will be able to join us over the next 2 Saturdays.
Thank you very much for that update from Senator Brown's office. Really appreciate that. I'm going to ask my panelists, are there any final thoughts and reflections that you'd like to share at this point? Anything that you really want to reemphasize and let our listeners and those who've attended, and we're still well over 100 who are here today, that you'd like to share as a final thought?
Well, okay, I have the mic. I can say, I think the legislation that has been proposed and is still sitting in committee, I think that's one area that we should help those legislators that are so focused on helping us pass those bills. I've looked at most of them and they all make a lot of sense and they will help us. I think, infant mortality affects and tells us what's happening in each community, the Black moms and the white moms and the brown moms, but it also says that our neighborhoods need business development investment. They need, again, business to go in and help people get jobs. They need a whole holistic approach to the neighborhoods, which the mayor has focused on: Linden, Hilltop, South Side. And so to really encourage and look at, I guess I can ask Edward Johnson for your public health innovation, because when you look at the cost of changing this disparities, it's overwhelming to public health, it's overwhelming to Medicaid. It needs the whole business community to put their money in and their focus and their help to turn these neighborhoods to an equitable neighborhood.
Absolutely. Any other final thoughts?
Yes, just to say thank you again for allowing us the opportunity to be able to speak on this panel with such great individuals, and to echo a bit of what Dr. Gabby said is making sure that we're looking at and addressing Black maternal, infant, and family health from an equitable perspective. And that also means, when we're talking about equity, being very clear about not only investment in businesses and in communities, but being very clear about investment in business and communities and those that have been most impacted over the longest periods of time. And so being really clear to center Black voices, being very clear to center Black organizations, Black-led organizations, being very clear to listen to those Black professionals and also to our Black community members, and centering that as the significant portion of how it is that we continue to develop policy and advocacy, leaning that over into legislation, being really clear that legislation is an extremely important part of being able to establish that equity. It also can sometimes lead to an inequity, as we have seen throughout our 400-year history with different types of policies and legislations that have been developed. So being very careful about the language, being very careful about who is being centered in that legislation, being careful about naming Black maternal and infant health, because of the health disparity that we have, in particular in Ohio, being very clear about who should be leading the charge, who should be helping with establishing the certification and the regulation that involves that, and making sure that those voices do not get lost on the Senate or the House floor. And we've got some really, again, I just have to say again, we've got some really great legislators, in particular Representative Erica Crawley, who has been a champion in this state overall, not just her district, but in the state overall, for advocating for the voices of the Black community and directly addressing our own health disparities. And so I hope that we will continue to be able to do that and be an advocate for that in this space and with other community partners.
Thanks, Jessica. We're going to close this out today with you and Dr. Gabby and any of the other panelists who are still here. What would you like to see CelebrateOne accomplish in 2021, and how is there a way for us to do it together? What is it that we're not doing now, or that you'd like us to see us to continue to do? And then how is it that you think we can work together?
Well, thank you, Maureen, and hopefully we get a follow-up to this, but continue to support us as you have. That is critical for us and our moms-to-be and our dads-to-be program. Again, your continued support and advocacy for us is just so critical, and I think we can show you good data now that and as you looked and you saw that CelebrateOne neighborhoods, the infant mortality has gone down in our neighborhoods. Just think of it. I mean, Linden was 21,000 when we started. I mean, I can say I'm really optimistic, and I know each year we get ups and downs, and this year so far we're not doing as well as we did last year. Maybe it'll come back. But don't be discouraged. You know, our trend line is down. So again, continuing to support us with the funds that you've been doing, and you've been advocating for us with Medicaid. You've been highlighting how important these group-based, place-based models are you know, the moms feel so respected, and they feel honored. I mean, the governor came to Wineland Park in the church basement and held our babies. And, you know, that kind of respect and acknowledgement of how important the Black pregnant woman is, I think, so bringing more publicity, bringing people in to see what Columbus has done. Okay, I have to put in, you know, I'm competitive, and I shouldn't be, but you know, Cincinnati's been getting press for Cradle Cincinnati. I can say that CelebrateOne and Moms to Be and what we've done is just as important. And you know, we could be doing more publicity and more publications, because we need to keep the funding coming for CelebrateOne also.
That's a wonderful suggestion. Thank you very much. And we will reach out to kind of talk out some other ideas. And you know, I'm scheduled to come over and meet with you soon, I believe, and participate in one of your trainings. Yep, absolutely. Jessica, what would you like to see Celebrate accomplish in 2021, and how can we partner to make that happen?
Well, thank you for offering that question, Director Stapleton. I think that I'm very encouraged, and we are looking forward, myself and my partner, Jorian Wingarter, are looking forward to being able to have more direct communication with you. The first is to deepen relationships. So there's been side-by-side work, but there hasn't necessarily been that deep connective work that has happened. And I think that it's really important that we let the statistics speak for themselves. I'm a public health professional, and so for me, it's really important when we take a look at those stats that we disaggregate those stats as well. So being clear and making sure that the neighborhoods that have seen the decrease in Black infant mortality, that we're seeing that because there has been a significant decrease, not because there's been a population distribution or a displacement where it's just simply moving into the next zip code, which is something that we do a significant amount of research and study on. Being clear about, again, lifting Black-led organizations and other Black doulas that are not necessarily part of Root. And Root does that. We do the best that we can to try to do a really great job of connecting to other Black doulas and other Black perinatal support workers that are in the community, so that if our services aren't necessarily the type of services that our community wants, we make sure that there is that interconnectivity, and not being afraid to step boldly into having these conversations that are surrounding things like, yes, we need to address safe sleep, but we also need to address safety. And that part of the concerns and issues in our communities are not only community safety, but really elevating it to those levels of the interactions that we may feel that we have with law enforcement, which is part of a reproductive justice agenda as well. So what we would like to see CelebrateOne accomplish, and what we would like to accomplish along with you, is being able to have more of these larger and honest conversations that aren't as siloed about the stereotypes about our community, and more addressing what the social ills and inequities are, so that we can utilize some of what we do in our program on the more broad scale for Franklin County and the state overall.
That is instructive, and I can't wait to have the conversations with you and Jordan over the coming weeks.
Yes, thank you.
Thank you. I believe all of the rest of our panelists are no longer with us. And so at this point, I would like to thank Mayor Ginther, Representative Crowley, Senator Kunze, and Jessica Roach, Dr. Pat, Gabby, Edward Johnson, the CelebrateOne team, and every last one of you who is here today and spent the time. Again, we are just under 100 right now of people who cared enough to be on the phone through the very end to do what we do best, which is to find out information, share it with each other, find ways to collaborate so that these people on the screen can continue to reach their first birthday and our communities can be healthier. And so with that, we thank you for your attendance and your time, and we thank all of the panelists for their wonderful contributions to today.
Thank you.